Okay, I'm here today with Adam Jellison, massage therapist and instructor extraordinaire here at the Aubrey Center School and Center for Advanced Massage Therapy. So welcome, Adam.
Thank you.
So Adam, when did you start your career in massage therapy?
I actually started, when I started here, which was in 2005 when we opened. Okay. And I started basically straight out of school. And I was drawn to working here because this is the mission of this place, of the Aubrey Center, was basically what I was looking for in my own career. So I knew if I was going to grow and become a certain type of therapist, this was the place to do it. And that, led me in the right direction.
So I guess what drew you to the Aubrey Center, I guess, compared to teaching at other types of organizations? Like, what made this place special?
Oh, as far as the teaching end goes, I did teach at another organization, and as much as I love teaching, it wasn't a very student-oriented type of school. It was, it just took away from what I was trying to do, which was I just wanted to make sure I was producing a good product, for lack of a better term, meaning I was producing students that went out in the field who were comfortable and had the skills that people would want in an employee, obviously. And then what drew me here was the fact that I could do all that with my students. I had the ability to teach the way I want to teach, and if you're here and you want to learn, I'm here 100% for you, and that's the type of school this is.
Mm-hmm. So what kind of teacher are you? Like, are you more hands-on, more focused on the books?
Both. I mean, you have to have both.
Uh-huh.
The hands-on is absolutely what most people look forward to, and it's obviously what I'm going to concentrate on. I want all the students, that is, to come out feeling like they've had plenty of hands-on training, and I want them to feel comfortable when they leave. As far as book work, lecturing, classroom type stuff, it's more of an interactive setting. So we're not just going to sit there and read out of the book all day, and everyone's used to that. No, it's not happening here. It's not happening under my watch. I want students to have fun, basically, but to really learn and get a full understanding. I don't want anyone leaving thinking to themselves, gee, I'm really still confused on that one topic we went over. So that's not going to happen here, if I have anything to say about it.
And as a practicing massage therapist, you can give them the benefit of your experience.
Absolutely.
I would imagine, right?
Yeah, and that's what I used to teach. If we're going to talk about sciatica, we're going to talk about my clients who have had sciatica. Of course, names excluded, but right. We're going to talk about what I did, my approach and how it's changed over the years, and why I now tackle that problem differently. And I want them to understand it inside and out, not just physiologically why it works, but I want them to understand the results that I get from it with my clients.
And in terms of your approach to taking care of clients, I would imagine that you focus on helping clients live pain-free lives and active lifestyles, that kind of thing?
Oh yeah, absolutely. I always say this to clients is, it doesn't matter what I feel, because they always say, oh, do I feel like, does my body feel like it's getting better? I don't care what I feel. I care what you feel. So when you're not in my office, if you feel excellent and you can go out and play tennis or go to your job and play with your kids or do whatever, then I'm happy. I don't care. Whatever it takes. And so it's more about results. It's not about me saying, well, you have whiplash, so we got to handle it this way, and you have absolutely no say in it. And the other end of it too is I want them to go home doing the right thing, because what got them there to begin with, I don't want that to happen anymore. So in case of a repetitive use injury, we're going to change that repetitive use a little bit. So I'm very big on giving tips to my clients so that they go home and change some of their behavior and alter little things so that their problem doesn't come back.
So it sounds like you have like a custom approach to each client, like you approach each client as a different and unique scenario?
Yeah, absolutely. There's no cookie-cutter way of doing it. I can have 10 clients come in all with whiplash, and all 10 I do completely differently. You have too many factors at play, and so I try to just individualize it. I don't go in saying, I know exactly what I'm going to do. I mean, I don't want to say I wing it, but in a way I do, because I listen to what they tell me. They tell me how the accident happened or whatever got them there to begin with, and I take my approach accordingly to what they say.
Excellent, excellent. Well, very informative. Thanks for your time.
No problem. Happy to be here.